All right, we've been talking about symptom management, and let's talk about the constipation factor.
Okay, so as difficult as it sounds, to talk about constipation is really an important symptom management issue, particularly for people with lung cancer. Lung cancer is often associated with pain. Pain requires narcotics for treatment, and the point, I can't make it strong enough, every narcotic is always constipating.
Yes.
And if you get a narcotic, the doctor prescribes a narcotic, it has to be given with some sort of bowel preparation, either a softener or a stimulant. And so there were some papers today, again, nothing earth-shaking, quote unquote, but clearly re-emphasizing in educational sessions and scientific sessions the importance of constipation as a way to improve quality of life for people with lung cancer.
And quite frankly, all cancer types.
Generalizable.
Yes. And then I was asking you about the issue of skin reactions with some of the targeted oral therapies.
So the epidermal growth factor receptors, Tarceva, Erotinib, give this rash. I can walk through to the waiting room and I know who's on Tarceva, who's not, by this rash. And I didn't come across any scientific sessions that dealt with the management of the rash, but certainly in the educational sessions. And again, cancer.net has great stuff on the management of these. It's basically symptom management, and there are a number of techniques that really parallel in some ways the management of acne, teenage acne, in terms of moisturizers. The antibiotics are some benefit.
And which carries, because then it's a visual thing, and there's the self-esteem issue, and that there's a real psycho-oncologic issue too, because when no one can see what you're going through, it's one thing.
But it's paradoxical. We do know in general, the more severe the rash,
right,
the more effective the drugs.
Exactly.
And you tell the patient that and they say, you know, I don't care what I look like, as long as it's working.
I do have a question about the issue of compliance, because lung cancer represents one of the disease types where there are these oral therapies, and there's been so much discussion in previous meetings about concerns about patient compliance and adherence. They've been around a while now. How are we doing in that area?
You know, we like to use the word, the more politically correct word is adherence. So are you sticking? Are you adhering to my recommendation? As opposed to compliance, which really is a more give and take. And it's a fairly clear, this is what I'm suggesting, this is what I want you to adhere to in terms of a schedule. So example, you could talk about this new drug, the inhibitor that we talked about earlier, it's a pill. And there's always concern about taking a pill that can cause side effects. And so there always is this issue, and in clinical trials, an important question is, did the patient adhere to the schedule? And that's always an issue, because if the person didn't take the drug, then although there's an intent to treat analysis, everybody gets included. In fact, you shortchange the experimental side if there is lack of adherence. So this is an important thing to look at. Example, in the clinical trials, were the patients, subjects, adherent to the recommendation, particularly for an oral drug. So it's a challenge, but again, I think the stakes are high, and fortunately the drug that we talked about, the ALK inhibitor, is minimally toxic relative to other kinds of cancer treatment.